lateral part of the medial condyle. This semilunar surface is a prolongation backward of the medial part of the patellar surface. As the leg is carried from the flexed to the extended position, first the highest pair, then the middle pair, and lastly the lowest pair of horizontal facets, is successively brought into contact with the patellar surface of the femur. In the extended position, when the quadriceps femoris is relaxed, the patella lies loosely on the front of the lower end of the femur. During flexion, the ligamentum patellae is put upon the stretch, and in extreme flexion, the posterior cruciate ligament, the oblique popliteal, and collateral ligaments, and to a slight extent, the anterior cruciate ligament, are relaxed. Flexion is checked during life by the contact of the leg with the thigh. When the knee joint is fully extended, the oblique popliteal and collateral ligaments, the anterior cruciate ligament, and the posterior cruciate ligament are rendered tense. In the act of extending the knee, the ligamentum patellae is tightened by the quadriceps femoris, but in full extension, with the heel supported, it is relaxed. Rotation inward is checked by the anterior cruciate ligament. Rotation outward tends to uncross and relax the cruciate ligaments, but is checked by the tibial collateral ligament. The main function of the cruciate ligament is to act as a direct bond between the tibia and femur, and to prevent the former bone from being carried too far backward or forward. They also assist the collateral ligaments in resisting any bending of the joint to either side. The menisci are intended, as it seems, to adapt the surfaces of the tibia to the shape of the femoral condyles to a certain extent, so as to fill up the intervals which would otherwise be left in the varying positions of the joint, and to obviate the jars which would be so frequently transmitted up the limb in jumping or by falls on the feet. Also, to permit of the two varieties of motion, flexion and extension, and rotation, as explained above. The patella is a great defence to the front of the knee joint, and distributes upon a large and tolerably even surface, during kneeling, the pressure which would otherwise fall upon the prominent ridges of the condyles. It also affords leverage to the quadriceps femoris. When standing erect in the attitude of attention, the weight of the body falls in front of a line carried across the centres of the knee joints, and therefore tends to produce overextension of the articulations. This, however, is prevented by the tension of the anterior cruciate, oblique popliteal, and collateral ligaments. Extension of the leg on the thigh is performed by the quadriceps femoris, flexion by the biceps femoris, semitendinosus, and semimembranosus, assisted by the gracilis, sartorius, gastrocnemius, popliteus, and plantaris. Rotation outward is effected by the biceps femoris, and rotation inward by the popliteus, semitendinosus, and to a slight extent the semimembranosus, the sartorius, and the gracilis. The popliteus comes into action especially at the commencement of the movement of flexion of the knee. By its contraction, the leg is rotated inward, or, if the tibia be fixed, the thigh is rotated outward, and the knee joint is unlocked. End of section 18, the knee joint. Recorded by the Bodster. From Anatomy of the Human Body, Part 2, by Henry Gray.